Thank you for your enthusiastic response to Restoring Health Holistically. I would just like to make clear that I am not a medical practitioner. In order to heal my own illness over the past 17 years, I've become a holistic health author, educator, and an advocate. But this does not provide the depth of knowledge that's needed to treat illnesses. I research any illness I have, and then I make an appointment with a holistically trained practitioner to discuss a treatment plan. And this is a collaboration between you and your doctor. Western medicine primarily treats symptoms with drugs forever. I prefer to seek practitioners who are trained to treat the causes of illness so that I will get well. The titles that I look for are naturopathic doctor, or ND, functional MDs, orthomolecular doctors, chiropractic neurologists, and certified energy medicine practitioners. These TV shows are intended to raise consumer awareness of holistic treatments and explain how they work so that you can make informed decisions and find a practitioner to work with and get well. Thank you. Hello, I'm Gracelyn Guyol, and with me is Lois, Arias, my Facebook page manager, who sends your questions to me. So give us a few highlights of what we're going to talk about today.
Well, we're going to continue a little bit further about acupuncture, and we have a lot of questions on antibiotic use.
Okay.
And how the treatment with medicines differ in holistic healing.
All right, good.
So the first one is, what is your position on antibiotics?
Antibiotics are currently sort of under fire because, for two reasons. The medical industry has overused them, and they're also overused because they're given to animals that are raised on factory farms to keep them alive, and thus, humans are getting exposed to more antibiotics, and these antibiotics are becoming resistant. So we're becoming antibiotic resistant, so that they're not going to be very effective anymore. And so, but I want to say that I'm not against antibiotics because they have been like miracle drugs. They only fight infections that are caused by bacteria, not by viruses.
Could you explain the difference? I think a lot of people don't know the difference between a bacterial infection and a viral.
Well, say that a cold is caused by a bacteria, and a virus causes Ebola. So you have viral infections, and they are treated differently. And antibiotics are not effective for viruses. They're only effective for bacterial infections. And so, but patients don't know this. And so every time anybody starts to come down with something, they call their doctor and say, write me a prescription for an antibiotic. And over the years, doctors are happy to accommodate their patients because people don't want to hear antibiotics don't work on bacteria and they don't work on the common cold. They don't understand that, so they just want what they think was a sure cure. But it's not for everything. And so the problem is that because in hospitals and by doctors' offices and by consumers at all levels, we've relied on them too much because they were such magic when they first came out. And I'm just going to give a little bit of history on that because it's interesting and I think it's instructive to help people understand what's going on. Anti means against, and biotic means life. And so antibiotic drugs are prepared from natural compounds that kill bacteria. And some harmless bacteria defend themselves by creating chemicals that destroy other bacteria. So that was where it started.
was knowing that certain bacteria, it's the fight of the bacteria. Certain ones kill others, and so if you can harness this, then you can use it to kill pathogens, pathogenic and disease-causing bacterials. The antimicrobials, which is what these are, have a history dating back to Sudanese Nubia in 350 to 550 BC, where traces of tetracycline were found in human bones. Other antimicrobials were used for centuries in traditional Chinese medicine. One example was an anti-malaria drug that was extracted from the Artemisia plants. So using these plant and mold chemicals, natural chemicals to kill bacteria is not new. It's been going on for a lot of years. But what changed was that there were certain diseases that were prevalent in the mid-1800s and probably before, such as syphilis, that no medicines touched, and they would give people treatment that involved using mercury, which didn't cure it and had a lot of horrible side effects, but it was the best they knew the best shot they thought they had at it. But Paul Ehrlich and others led to an antibiotic that cured syphilis in 2009, and that brought everybody excited about prescription drugs. And so the next big excitement was the discovery of penicillin. In 1928, Scottish doctor Sir Alexander Fleming was growing colorful bacteria in covered dishes in his lab, and he noticed there was something green, green mold forming on one dish. And the bacteria closest to this green mold appeared to have disappeared or dissolved. So they knew about molds and they had names for them. And so this mold was identified as Penicillium notatum. But it was not easy to purify this mold so that they could use it in a medicinal form. Yet when World War II started, and this, you notice this was discovered in 1928, and they were still trying to figure out how to use it when World War II started, which was in 1937. So as the war progressed, it caused a professor of pathology from Australia and a biochemist who had fled Germany to push the research forward and to really, and they succeeded in purifying penicillin. So by 1942, thanks to their work, it was able to produce penicillin, mass-produce penicillin, and it saved millions of soldiers' lives and limbs because they could stop these bacterial infections. Pneumonia once killed 60 to 80% of people who came down with it. And penicillin lowered that rate to 1 to 5%. And so the many lives that have been saved by these antibiotics is why they're still considered miracle drugs, because they were, in truth, have been for 100 years. But they are overused, and they're becoming less effective, and some are almost not effective because of the overuse. And that's what's concerning the Centers for Disease Control and other people responsible for health, national health. I use antibiotics as a last resort when nothing else will work. And the time that I use it most often, and probably the only time I've used it in the last 15 years, is when I'm an avid gardener and I live near Old Lyme, and actually the Lyme disease tick and Lyme disease itself is all over the world. It's not just near Old Lyme or this part of the United States. It's in the all over the world. But when I've been gardening and a couple of days later I find a tick that I didn't notice, and it's been on me for too long, then I immediately get a prescription for doxycycline, and I take it for 30 days. And then I call my naturopathic doctor and I ask for her to prescribe me a probiotic. And I take the two together because antibiotics kill all the bacteria, not just the bad ones in your gut and in your system. and that's how they stop the infection. But the bad side and the downside of that is if many doctors have not been taught to prescribe probiotics with the antibiotics. So she has me take an antibiotic in the morning as prescribed, and then later in the day, I'll take a probiotic to replenish the good bacteria in my gut, and then at night you take another antibiotic, and so then you keep cycling. And it depends which antibiotic you're taking and how often you have to take it. But basically, you try to time it so you let the antibiotic do its work, and then you bring in the probiotic to replenish and restore the beneficial bacteria in the gut that's really needed for digestion and for many other processes that feed your system. So, so you want to avoid depleting the good guys and kill off the bad guys. And some people say, oh, well, I just eat yogurt. Well, a doctor told me years ago, you'd have to eat 40 pounds of yogurt a day to get what you get in one probiotic capsule. So it's a very inefficient, ineffective way to replenish the gut flora.
Can I ask you a question
Sure.
about probiotic? I see them unrefrigerated at a supermarket or a pharmacy. At a health food store, they're always refrigerated.
Right. If you have a rapid turnover of stock, you can probably not refrigerate them. But I always refrigerate mine, and I get mine through my naturopathic doctor, and they have been refrigerated. So it helps preserve. If they're not refrigerated, I assume that they can get hot and they can dry out, and then they would be dead.
Yeah.
They won't be live, and you want as many of them still live in the capsule as possible. So it's not essential, but it's helpful if after you buy them from a place that has a good turnover of stock, so that they haven't been sitting there for 6 months before you ever get them. And they also keep them in the refrigerator just to protect their liveliness.
I'm going to interject a question that's not on here, and you might have to save it for a different show.
Okay.
But my doctor in New Jersey would not prescribe an antibiotic unless, you would die without it. He just was very anti.
Okay.
He was very afraid about patients getting C. diff from antibiotics.
I don't know what that is.
So we'll
have
look
to
it up
look it
and
up
save it for
answer
another show. But I know several of my friends have also had the same thing where the doctors were concerned they had it.
Well, there are certain antibiotics, and it depends on the antibiotic, are known to trigger some not beneficial side effects. And so I would leave that to the doctor's discretion. I would follow it, but I would also look it up. Like me, I want to know what's going on.
So we can find the answer.
So we'll find the answer
and give it
remind
the next
me
show
of it. Okay.
All right. What should I expect during acupuncture, and what should I wear?
Much like other treatments, you'll meet with the practitioner. They'll ask why you're coming, or they probably would have asked that over the phone when you made the appointment. And they'll ask the specific issues that you're concerned about and that you want to address. Depending on your answer, you may be examined in a private room, so they might do a further physical exam to palpitate or to feel if you have growths or areas of stiffness or pain, to try and figure out exactly what they're near, the acupoints that they're near. And typically you would have a treatment table in a private room where you would be treated with acupuncture. Wear loose, comfortable clothes. It depends on the acupoints that they need to access for treatment, whether you need to unrobe and put on a gown, or whether you can continue wearing your own clothes. It just is dependent on the whole situation. So that covers that question.
Okay, how are the needles sterilized? This is a three-part one.
Okay, all right.
How are they sterilized? Will it hurt? And are there other options, because I'm afraid of needles? That's not me, that's whoever asked.
Right, okay. The acupuncturists that I know of, and I'm assuming that this is common across the industry now, they no longer sterilize the needles. They use a new needle for each patient each time you come in. And so there's no risk of cross-contamination with someone else or with yourself, if you know. So I think that that is an older issue that used to be of concern and has been solved by the industry. And these needles are really fine. Now there's some differences, I think, in them, but they're pretty fine. And so it's more like a prick. It's not like getting a shot, because it's a very fine gauge wire that's sort of going into your finger or your body, and they do it very quickly. So it's sort of a quick prick, and then you're unaware that it's there unless you hit it or something. So it doesn't hurt really. It's not even like a bee sting. I mean, it's really very mild. And yeah, but if you have a needle phobia, you can use acupressure instead of acupuncture. And so there is always that option. And the light therapy that I tried and talked about briefly in the last show uses acupoints for letting the light go in through the acupoints for healing purposes. So there's also LED light therapy that can use the acupuncture junctures and meridians for healing purposes. So you have light and pressure and needles. So take your pick.
How long does a treatment take, and how long before I feel better?
Different lengths, different types of treatments would take different lengths. Depends on the seriousness, obviously, of what you're addressing. But the acupuncturist that I talked to offered 20-minute, 40-minute, and 1-hour sessions. And she could recommend what you start with. So that's part of the assessment that goes on. It also offers people a shorter session if they can't afford a longer session. And so maybe they have to have more sessions and space them out and have them shorter, just from an affordability standpoint.
Does insurance ever cover it?
I don't think so. And I think it will at some point, but to my knowledge, insurance doesn't cover much of holistic medicine because they're not required to. And this is another issue that needs to be addressed, but we won't go on to that rant right now.
No, because you get me on my soapbox, forget it.
Okay.
What is the difference between traditional Chinese medicine and, traditional Chinese medicine acupuncture and acupuncture done by a healthcare professional?
Acupuncture is acupuncture. Doesn't matter who's trained, but there are different levels of acupuncturists. And so you want to know the training of the one that you're consulting. And because the requirements vary by state. For instance, in Alabama and Idaho, they only require 100 hours of coursework for licensing in acupuncture, and that doesn't sound safe to me. Doesn't sound very professional to me. It sounds too quick. Arizona requires 1,850 hours of training and 800 hours of clinical experience, trained clinical experience. And in California, they require 3,000 hours of training from an accredited school, plus 50 hours of continuing education every 2 years. So each state has different requirements, but I would go for the more hours and more on-the-job training rather than something that's only 100 hours. Just doesn't seem appropriate. Traditional Chinese medicine, however, covers acupuncture and a whole lot more. I went to the University of Bridgeport website to find out what they required for a Master of Science in Traditional Chinese Medicine. And first, to even get admitted, you have to have a bachelor's degree or the equivalent, 120 hours of coursework before you get admitted. Then the curriculum that they offer includes 9 acupuncture courses covering theoretical and practical information such as learning to identify the acupuncture points by anatomical location, palpitation, and proportional measurement, as well as how to do acupuncture, moxibustion, cupping, and electrical stimulation using acupuncture needles.
My grandmother used cupping.
Oh, did she? I've experienced that too. And
It's similar to leeching,
yes,
isn't it?
It's
Yes.
wild. And then they have 12 Oriental medicine theory and diagnosis courses that cover the scope of and philosophy of Oriental medicine. 12 Western biomedical courses to train students about medical terms, history taking, physical exams, and diagnostic skills. 5 courses in herbal medicine that introduces the Chinese pharmacy, common North American botanicals, and drug-herb interactions. 10 courses in Chinese herbology and the clinical application. 7 courses on movement and respiration, 2 courses on counseling, communication, and practice management, and 9 clinical experience courses that allow students to develop confidence in their clinical interpersonal communications and decision-making skills. So this shows you that acupuncture is a treatment in itself, but but traditional Chinese medicine includes acupuncture and a whole lot more that is part of the Chinese approach to healing.
Sorry, that was from the last one. What are the main things that, and of course it was the circumcision one. What are the main things that help determine what may be causing your health problems?
The foundation of health really depends on what you eat and drink and how often. If you miss meals, it causes the body to become stressed and causes your brain to function less well. And constant stress contributes to all the major killer diseases: cancer, heart disease, mental illness, diabetes. So stress is really an important thing to control, and eating regularly keeps your body less stressed. Having meals frequently keeps you better fueled, and when the body starts to run out of fuel, it goes into stress mode, and the body produces adrenaline to keep your blood sugars high enough so you can keep functioning. And that's not an ideal state. So you want to avoid stressing your body on that physiological level, as well as stressing it through the mental stress that we deal with.
I had been diagnosed at one point with hypoglycemia, and if I was getting moody, I was staying with my mother at the time, she would bring in a half a cantaloupe and cottage cheese. I'd be fine after it.
Right, she had some instant sugar and some protein to go longer. So that's why I stress that people really need to eat 3 meals a day. They don't have to be big, but they're spaced out so that you're sort of not drip feeding literally, but you're periodically giving your body additional fuel. So the other thing that's really important in determining the outcome of your health is daily exercise. I cannot tell people how important this is. Humans evolved moving. They had to walk everywhere. They had to work physically. We are now in this sedentary society where we don't move unless if we can get somebody else to take us there. So, and it's very unhealthy, and it's part of why our culture has so much disease. So exercise every day, whether you want to or not, because your body needs it. But to determine, with this question, I wasn't sure. I think they wanted to determine a particular cause of a health issue. And so that involves the process that I refer to as Sherlock's process. And in that, you take a family health history to see what traits might be inherited and be part of the problem. And those traits can be often compensated for because they cause you to overproduce or underproduce certain nutrients, or retain certain nutrients in the body. And then you take a personal health survey to see the issues that that person is trying to deal with, and these give practitioners clues to what will what's the underlying cause, because certain systems may be involved in all of the different symptoms. And then you run lab tests to check for deficiencies or imbalances in specific nutrients that are, or hormones that are required for health, and adjust these levels to improve health. Regular detox is really important, especially in this society. Over 80% of our foods are sprayed with pesticides. So unless you can afford to eat organic, you're taking in a lot more than healthy nutrients. And so I've talked in the past and in my books about how to detoxify daily, what foods help you detoxify, and fluids, and how to do a clinical detox if you have a toxic overload. So that's why holistic healing requires that you do a process of discovery and recovery, working with a licensed and trained practitioner. It will save you a lot of time and from making simple mistakes.
How long does it typically take to heal? We've had this question before, but
it keeps coming
they
back.
ask it again.
It's like asking me how long it takes to fly. Well, it depends on where you're going. And so, if I'm going from here to San Francisco, it will take me 4 or 5 hours. And if you're trying to heal something, a simple headache, it may take you something like 30 minutes, or it may take a week or days to look back every time this headache comes up. What have I eaten or drank or done in the last 48 hours? Or sometimes even 72, but 48 is easier, that might have triggered this headache. And after a while, if you're paying attention particularly to what you eat, you begin to spot the things that make you feel not well, the things that precede a headache. If it's a migraine...
I was going to ask that, yes.
Yes. If it's a migraine, it may take you months to figure it out, because migraines are often allergies to or sensitivities to things that you don't know that you're allergic to. Or it can be due to hormone imbalances, and that's a very common one.
Can stress cause it?
Stress can trigger migraines. Stress can trigger a lot of different things because it's so hard on the body. And so what you need to do is do things that help change the body from a state of acidity to an alkaline pH, and that will improve your health overall. But while you're figuring all this out, each case and each person will be absolutely unique. The thing that I can say is some people heal a lot more quickly than others. And so years ago, I noticed whenever I needed stitches, the doctor would tell me to come back in, I don't remember now, 10 days or something. And I would go back and they'd take the stitches out and the wound would reopen. And so they'd have to, when I got home, it would reopen and they'd have to restitch it. And so I learned to say to doctors, you need to leave them in a couple of days longer than what you do for normal people because I'm a slow healer. Fast forward 20 years, and the clinic that ended my bipolar told me that this slow healing was because I had an inherited condition that was stripping my body of zinc. And zinc is required for healing. And so if you don't have adequate amounts of zinc, you heal more slowly or you don't heal at all if it was severe. So, and years of research in the mental health field shown that zinc deficiency is a major cause of mania and anxiety and violent behavior.
And you found that out before the bipolar research?
No, during the bipolar healing, I learned that, and that's well known by holistic trained practitioners who are aware of these 4 inherited errors that are in both of my books that contribute to all mental illnesses. And they're inherited, but they can be compensated for with natural supplements of specific ones, not just generic in general. So by supplementing my zinc deficiency and that B6 deficiency, my manic highs disappeared after 4 months. They stopped occurring because the extra zinc was bringing my copper levels down, and when zinc and copper keep each other in balance, you don't have the violence and the mania. And so I continue taking zinc for the rest of my life because of this inherited error. But the thing you have to be careful about if you don't do this on your own, because the metals that are important for health in the body, zinc, copper, and iron, if you get too much of them, the body stores them and they can accumulate and they can cause really serious health problems. So this is not something that you want to self-diagnose and start taking 100 milligrams of zinc a day. That will cause a lot of problems for most people. So please don't do that. But do get help, because there is treatment for if you heal slowly, you probably need more zinc, and so get tested and take a look at that. And if you have mental illnesses, get your zinc and copper levels and those 4 inherited errors tested for. There are lab tests for that.
I don't think a lot of people are aware of how zinc and these metals affect the body. So
Right.
I'm really glad you're discussing it, because
Well, I can't tell you all the details, but there are certain things that I have just in trying to heal myself, I've become aware that these are important to health, and an overload causes disease or issues. So don't do this on your own.
oh, this is going to be a complicated one here. My neighbor's husband is over-medicating his wife. Are there holistic modalities or supplements that could help her? And as you saw, there was a list of meds.
Yes. Holistic medicine usually has an option that can be as good as drugs, but they don't work the same way as drugs. So you can't supplement one for the other. You know, it's a different form of treating. Drugs basically address symptoms by suppressing the symptoms, and not all. You know, in the case of antibiotics, they kill the bad guys, but usually it's a suppression of symptoms. Holistic is addressing the causes and try to fix the cause so that your body functions better on its own, using the built-in healing mechanisms that our bodies have. But I am sure this person means well, but unless a husband or her patient asks her for advice or to find help for them, there's nothing she should or can do. They're most likely to say, mind your own business. Mm-hmm. And I actually agree with that. Each individual or family is responsible for their own health. And so I don't offer advice or information unless people ask me for it or indicate an interest or a willingness to know something. Because I don't want people to feel like, oh, here comes Gracelyn and she's going to tell me what to do, and I really don't want to hear it. I don't want to waste my time and energy also on people that really aren't interested in changing their medical regimen. If it works for them and they're happy with it, fine. I have nothing to offer them, and I don't try. So I would suggest that this woman might say something to the woman friend and see if there's any interest, but it's not something that I didn't look at the list of medications. I'm not a licensed practitioner. I wouldn't make any recommendations anyways. And so I think that there is nothing that she can or is appropriate for her to do as a neighbor.
And I think that the older generations mm-hmm. don't trust anything but doctors.
That's true. And so may they continue.
May they live, and may he not be doing it intentionally.
No, I don't think people would do it intentionally.
No, not unless you're in an Alfred Hitchcock movie.
And they're very rare.
We had already discussed holistic medicine on animals, but what if you have allergies? How do you treat allergies holistically? And what do you recommend for it?
Well, what I recommend is turning off the allergies, and it is possible to do using different treatments. My first book had NAET, which stands for Namboodirpad's Allergy Elimination Technique. And the founder, Dr. Devi Namboodirpad, is an MD, a doctor of chiropractic, a licensed acupuncturist, and a PhD. And she got all those degrees because she was allergic to hundreds of different things and she could hardly find anything to eat. So allergies are abnormal immune reactions to substances that most people's bodies find harmless. And there are two basic categories: environmental allergies such as pollen, dust, molds, animal dander, the chemicals and cosmetics, and foods. Those are the two main categories. The primary cause is a weakened immune system from hereditary factors, toxic overload, eating the same diet all the time, and so it's a very repetitive diet, and or leaky gut. And leaky gut was my source of most of my allergens and was the source of the allergen for my cat, that I had him have allergy elimination treatments as well. And how leaky gut occurs is if you are reacting to a food and you're not aware of it, and you may have a headache from a reaction to it, you may have achy joints. My shoulders ached a lot before I learned that I was allergic to gluten and anything in the wheat family. So leaky gut causes inflammation of the gut that damages, it causes the villi, that are the little fingers that come up around the lining of the gut that absorb all the nutrients that are being digested. And so when that is inflamed, that villi is flattened, and you have malabsorption. You don't absorb half of what you're eating and digesting.
That's me.
And so as a young child, I was always extremely skinny because I was malabsorbing what I was eating and nobody knew it. And it took 40 years for me to figure it out too. So allergies, these abnormal immune reactions, cause the body to produce antigens, and they are unique chemical markers that are found on the cells of every living organism. And when the body detects a suspicious entity, the immune system compares our antigen to those of that entity. So what happens is when your gut is inflamed, the foods aren't properly digested because you don't have the right bacteria, or it's being killed off by the inflammation. And so things are not digested properly. Also, the lining of the gut, which is the surrounding part of the gut, loosens up. It's very tight because it's supposed to contain these things until they're digested and in the proper form, and then they're allowed to go into the bloodstream. So it's very tight, but with the inflammation, it loosens up and it becomes porous, a little bit like a cheesecloth. And so partially digested molecules can filter through and get into the bloodstream. And the immune system sees these as aliens because they're not in the right size and the right form in that place. And so it produces antigens to bond on to that molecule and to mark it for elimination, tag it for elimination as an invader. And so it compares the immune system compares that molecule to our antigens and says, this isn't self, shouldn't be here. Mm-hmm. And then the immune system produces antibodies to attach to that invader and do the tagging for destruction and clearing it from the system. So antibodies are the cellular defenders. And once an invader is detected, the white blood cells produce millions of antibody proteins, and they make a specific type for each invader. So there are 4 categories of allergic reactions, and for simplicity, I've just combined them into 2. There's the rapid reaction allergies, which are really true allergies, and they occur pretty quickly when you encounter something that is not good for you. Delayed reaction are sensitivities, and often they're food sensitivities, or they may be a sensitivity to something else. But these include autoimmune responses. So this is where your autoimmune comes from, because you can get so many sensitivities to things that the immune system gets confused. And it starts reacting to everything. It becomes hyperreactive. And so, but most of these sensitivities can be turned off and reversed. So that's the process of getting rid of allergies is treating through different mechanisms the sensitivities and getting them turned off so that your immune system is not overloaded and hyperactive, reactive. So NAET is one of those. It uses she was an acupuncturist, and that led her to find this solution, Dr. Namboodirpad, and that involves putting a sample of the thing that you test allergic to in your hand. It's in a glass vial, and the practitioners buy these glass vials filled with samples of common allergens and sensitivities. And they put them in your hand, and they test your muscle. You hold out your arm with this in your hand, and they say resist the pressure to push your arm down, and that's called kinesiology. And if you're reactive to it, your muscle is weaker, so you can't resist the pressure as much. And so then they take it out of your energy field and say, okay, now resist the pressure, the same pressure that they're pushing on your arm. And if you're able to resist, then that means that that was something that your body finds is reacting to. So that I did first. That was about 15 years ago, and I found a practitioner who does this in Mystic, and her name is Catherine Poole, and she's a Chinese medicine practitioner and an acupuncturist. I'm not sure she was an acupuncturist. Yes, she is. And anyhow, she learned how to do Namboodirpad's allergy elimination technique to help a friend of hers. And so I went to her, and she I was sensitive to probably 13 different foods that I was eating regularly and didn't know I was sensitive to. And when I cleared those from my diet and had the allergy turned off, I was no longer reacting to everything. I had gotten so hyperreactive, and I was concerned about an autoimmune disease because of the allergy overload. That I could no longer wear any wool, not even cashmere. I had to have silk things next to my skin or thin cotton. And once I got these these layers of allergies eliminated, my system stopped being so hyperactive, and I can wear wool, and I can wear a lot of my favorite clothes.
I'm interested in that testing because I'm the generation where they didn't have you hold it in your hand. They pricked you with it.
Pricks, and that's not as very accurate. They're getting more accurate. Today there is something called ATT, and it is Advanced Allergy Therapeutics, and they have used the same principles as NAET, but they do it, and it's highly effective because it was developed through 16 years of clinical research, and it doesn't use medications, and it doesn't use herbal remedies or supplements, but it works on the relationship between the major organ systems and the inappropriate reactions to harmless substances. And this still is the immune system that's in charge, and I identify sensitivities and allergies, but it's different than NAET because that uses gentle pressure on acupoints that correspond with the organ systems. And this uses stimulation applied through a computerized system. And that supplies a subtle representation of the offending substance onto the surface of the skin using this computerized system. And this stimulation reduces the stress on the affected organ system, allowing for a more appropriate response in the future to that. So in simple terms, the NAET developed a lot of the treatment system, but advanced allergy therapeutics has taken that to the next level. And it's computerized, it's really simple and pretty fast, and it basically reboots your system so that it no longer reacts to those harmless substances. And that makes it pretty amazing. So that's the system that I found. My cat had been in a car accident when it was a kitten and been hit by a car and almost lost its hip. And it was on antibiotics for a month, and at that time I didn't know about giving animals probiotics just like humans do. And so he became very sensitive to a lot of different foods and was scratching and licking his fur off and really looking pretty unhappy and uncomfortable. And I found a vet in Connecticut that has a practitioner that uses this advanced allergy technique, and it only took 2 treatments to solve my cat's allergies.
I would like to find a way for me not to be allergic to cat and dog.
Well, you can do that too.
Yes.
It can do that.
I will have to get that
It makes
information from
cats
you
more comfortable and
specifically.
people more comfortable with cats.
Are you available for short answer questions by phone or email?
I do private consulting by appointment, but I don't treat people. So people need to understand the difference is that I am a consultant, but I'm not a practitioner. And that's a little strange, maybe. Unusual, put it that way. I listen to people's symptoms and their family history, and I suggest types of holistic practitioners that I think they might consider. And sometimes I have to help them locate one because there are a lot of states in this country where it's very hard to locate holistic practitioners. And I've even received calls from people who found my book somehow in India and Turkey and London, and one was in Africa someplace. A woman called me from in Africa and had just been discharged from a mental hospital there. So people find me, and I act as a guide and a counselor to help them, but I am not a practitioner. I never want to be. I'm not licensed to be, and so there's a big difference between what I do and what licensed practitioners do.
But you're guiding people to the right
I
person.
am guiding, and so
that's
if they
important.
want to contact me about a consultation, it's 1 hour, and they can go to my website. It's $125 for an hour. They can email me through the website, and the website is crazyrecovery.com, and it's there on the screen.
And it's also on Facebook.
And it's on Facebook, and you can contact me through you on Facebook.
And basically, it's the title of your second book.
Holistic Healing with Gracelyn?
No, I mean the second book you wrote.
Oh, who's crazy here?
here,
Okay.
yes.
Okay. Okay,
Appropriate title.
great, thank you.
How do you find and assess holistic practitioners?
I wanted to give you some websites, so I hope you can grab a piece of paper. I go to directories of different doctors' associations who I'm familiar with how these associations teach their doctors, and so I'm very comfortable in looking at those. But it depends on what kind of treatment they're looking for. The first is a naturopathic website. It's www.naturopathic.org, naturopathic.org. And these are trained naturopathic doctors. They have 4 years of undergraduate work and then 4 years of training as a physician. And they, in the state of Connecticut, they are licensed. It depends on the state. They're working to get licensing in more states. I think it's around 30 states now, was 15 several years ago. And licensing determines whether or not some insurance companies will cover the visit to the practitioner itself. They usually still don't cover any of the holistic natural supplements. The other website that I recommend for people is the Orthomolecular Society website. This is www.ohmsociety.com.
And what is?
Orthomolecular practitioners. That was a term coined by Linus Pauling a lot of years ago, 40 years ago. And these are practitioners who only use the right molecule. Ortho means right, molecular, molecule. And so they do not adhere to use of drugs. They use natural molecules only, and they believe that if you find the right natural molecule for your problem, you can heal it. And this organization was founded by doctors in Canada who were running a residential psychiatric facility in Canada for over 30 years that treated all different mental illnesses. And this was before drugs were widely used or available. And so they were using research from the 40s, actually, that found certain natural nutrients would help certain conditions. And so they based their research in the 60s and 70s on research that had been done in the 40s. And the Dr. Abram Hoffer founded the Orthomolecular Society 40 years ago and has had medical conferences of that society once a year in Canada. And I went to one of them several years ago in Montreal, and no, actually it was the other side of the country. But I spoke as a recovered bipolar patient to their patient session. And it was a very wonderful conference. And I encourage physicians to go because there's a great depth of knowledge from this group. And then there are the new kids on the block. They call themselves functional practitioners. And they are primarily, first it was founded by MDs who were convinced that there was a role for alternative therapies. And many of them were driven by personal experience, where one of them had a toxic overload of mercury and he was not able to remember what his patients looked like, and so he had to have photographs of his patients in all of his files. So he had been in China and worked in China for years and had breathed a lot of mercury in from the coal-fired power plants that run China. And so he came back to the United States and had to detoxify. And so he has written a book. And he is one of the founders of this functionalmedicine.org. And it's for practitioners whose main training came as MDs, but they also have NDs that have joined this group too, because I think people like the term functional rather than alternative. So that has taken off, and it does have, there is science behind it, and people that really know what they're doing and are approaching it from an in-depth, comprehensive way rather than superficial, take one class and call yourself an integrative practitioner.
If you have someone in your family who has a mental health issue that's so serious you think about putting them in an institution, is there a holistic place?
There are for a few things, but residential facilities for the mentally ill holistic ones are rare. There's one for alcoholics in, I've just gone blank, in Sedona. And that one takes about 10 or 12 residents. It's very expensive, and so the average person cannot afford to go there. But it's extremely good. It was founded by a former drug addict and a former person who was, I believe that he was a doctor. I can't remember precisely what kind of a doctor, but he had mental health issues that he learned to address, and they're now teaching people who come to their facility as a resident. how to eat and live and change their habits to maintain, be sober and maintain that kind of a lifestyle.
It would be nice if there were more of them.
Well, there was one in Berkeley many years ago that could house maybe a couple of people, but there really aren't residential holistic facilities that I am aware of. And if somebody out there knows of one, please tell me, because I've searched for them from time to time for parents of young men particularly who, if they have a severe mental illness and they're teenagers, but they're still dependent on their parents and living at home, it can be quite frightening if people have extreme violent tendencies to be a parent of that child. So I understand the need. I don't know of anyone that's filling that need right now, other than the conventional medical homes for the extremely mentally ill.
Well, I hope in the future there'll be more natural options.
Yes, I'm sure there will, but we're just not quite there yet.
Okay, wait a minute. Did we finish all our questions?
Well, we have one more that I thought, but we only have a couple of minutes.
Okay.
So let me just say, one of the questions was, what do you do when you're not making these shows? And so
I had that question here.
what I do is I spend time with my husband. I have a grown son, and I spend time with him and his family. I have a wonderful network of friends locally and around the country, because I've lived in 14 different locations, and so I have friends scattered all over, and some of them I still stay in touch with. I assist clients and friends who are struggling with health challenges, not just mental health, but cancer and things that are also considered incurable in some stages. And I give talks to women's groups and to NAMI, which is the National Alliance on Mental Illness, some of their chapters. When I'm traveling in those parts of the areas where they have those chapters, I let them know in advance and try to set those up. So I also have started accumulating information and research for 2 books. And started writing one a year ago and haven't made any progress to speak of. So Lois has agreed to help me with some of the research and get myself pulled together so that I can keep writing, because I think communicating and sharing what I have learned in the 17 years of my own personal healing and to help other people, it has value, and I would like to get it into a book form. So continue watching the shows, and good night. We'll see you for one last show next week. Thanks.